Right, hello everyone. It's Joanna here again. Today I'm joined by Paul, and he's going to give you an insight into what it's like to be the loving husband of somebody who's had cancer. So, Paul, could you just introduce yourself quickly, please?
Yes, my name's Paul. My wife was diagnosed with breast cancer in late 2015. This was the second time she had cancer. She'd had it before we met in the 1990s. Um, and I guess there'd always been the fear that one day it would return. Particularly as given that one of my colleagues at work, his wife had gone through sort of a similar thing, cancer in the 90s, and it came back in 2010. So there'd always been this nagging fear that it would happen. I worked overseas occasionally, and sort of on one occasion in 2012, I was sort of in KL in Kuala Lumpur, and she phones me up. We have a sort of daily Skype session, and she's sort of saying, I've got to go to the doctors. There's a lump I'm not happy with. So I just sort of dropped everything, flew back the miles from KL. But on that occasion it was a false alarm. Whereas in 2015, I'd gone overseas again, came back, gets to the airport. Tracy picks me up and says, "We've got to go to the doctors." It's like, right, okay. She says, I've got another lump. So we get home, and she sort of shows me the area, and it's just like, whoa, where did that come from? And it sort of all started from there, and saw the doctors. We were then able to go to Bedford Hospital. They found us an appointment pretty quickly in terms of Tracy going to see the specialist and get all the tests done. But because it was at the end of the day, Tracy had gone off into the various rooms to have all the tests. I'm sitting in the waiting room, and at the time the nurses were all wanting to get rid of us because we were the last patient. And that sort of changed after a while. That nurses started coming to talk to me and giving me cards, and I think, right, okay, what's going on? But Trace sort of asked that I come in when they did the diagnosis and the results, that I came in as well. And I think she wanted me to be engaged as far as possible in the process, so that at least I understood, all what was going to happen in terms of the surgery, the reconstruction, the chemo, so that at least I would then be able to provide support. So I wasn't going to be asking silly questions. I would be actually in the room, sort of understanding what the oncologist was saying and what everybody was saying, and that Trace could sort of then rely on me to sort of do the chauffeuring, the keeping the house going, taking her to work, because during chemo she was sort of also doing some weeks where she was working as well. Chemist, doing the injection the day after. There's one of the treatments you have to provide. There's an injection that has to be done the day after the chemo, and that was me who had to do that. And I was also the keeper of all the pills and tablets, which I don't think I've ever seen so many tablets at one stage. And she joked that I had to coordinate everything on a spreadsheet so that I could at least work out what was going on when. But I was there for waiting for her to come out of surgery. I took her to all the chemo sessions, so I could sort of it's difficult because you can feel, I could feel her pain, but I couldn't experience the pain. And we sort of said at the start, I will support you as much as I can. I know it's your challenge. She never liked the word battle. It was never a battle. It's not a war. It was something that was going to be dealt with. And I think I took heart at the start of the process, in that Tracy is very much sort of, right, let's deal with this step by step. And so she didn't sort of go,
It's a very logical.
She was very much, okay, let's sort the surgery out, then the chemo. What I don't think we quite understood at the starting point was, once you get to the end of the chemo, how much of a challenge it is in terms of, well, there's still all these side effects. And there are still pills to cover side effects and pills to cover the side effects of the side effects. but sort of seeing Trace go through it, and sort of the early days of sort of, you know, she used the cold cap the first time, but decided it didn't work, which meant that the hair started to fall out. But nobody, I think, had warned her quite, because it's just, well, the hair falls out.
Yeah.
But it's painful.
Yeah.
And the same with the toenails. So there were things that I think we learnt as we went along, and I think she found useful blog sites and websites to sort of find information, but it was sort of her having to go out and find those things, so sort of signposts of where useful people are. And I think that sort of sharing experiences, I think, is very valuable to cancer patients, so that at least they know they're not alone, and if they've got sort of symptoms of a particular type, then yes, they can at least understand all those.
So how did you feel through the initial diagnosis up to the treatment stage, watching Tracy go through what she was going through?
It's tough because I mean, it was Christmas time as well, so she was diagnosed just before Christmas, and they had originally said, "Oh, well, we can fit you in for surgery before Christmas," but Tracy decided, no, we'll do Christmas, we'll have a big family Christmas, we'll just park it, we'll just forget about it, have a normal Christmas, and then come 2016, okay, we'll then take the challenge on there. And at no stage did I think I was going to lose her. I always knew that she was going to come through it.
Yeah.
But coming through it is one thing, but sort of seeing the sort of the difficulties that she had in terms of coping with the loss of her hair, or the loss of the nails, or particularly the loss of the eyelashes. That was probably the moment when she was most at her lowest, I think, because she'd always loved her eyelashes, and it was all gone. So I just sort of went into support mode, and I think I was lucky in that my work basically allowed me to work at home, so I was able to be here and to do all the things that Tracy needed. But she did make sure that I had time for me, so she would sort of say, right, you've got to go to football, you've got to go and play golf, you've got to have a day where you just go off and just relax and just get out of the, if you like, the daily cycle. So I think from that regard, she was sort of pretty switched on and still the boss. She'll kill me for saying that.
So Tracy has had 2 bouts of cancer, and she had a mastectomy and reconstruction. How did you find that whole process in respect of time scaling, support provided from the medical providers that you were using?
For the surgery and for the chemo, it was pretty good. I mean, the staff at Bedford were always sort of saying, here's our card, here's the number, if you need to contact us, do so. And the chemo cycles as well, we were able to sort of get support from them. So she was on sort of 3 weekly cycles in terms of the FET-T treatment. And certainly on there was one occasion where after the 4th treatment, she got a high temperature after that, so therefore she had to go into Bedford Hospital to just sort of have try to sort of put in intravenously, just because her body was sort of, her immune system was basically at its lowest. So I think, I think she found that a challenge, because I think she wanted to sort of carry on as much of normality as you can. I mean, clearly in terms of the cycle, we got into a pretty good cycle. I'll say good, but it was sort of, Thursday was chemo day, Friday was the injection the day after. Friday was usually all right, sometime on Saturday was where Tracy's body would start to sort of say, no, don't like this. And then there would be sort of 2 or 3 days where she would feel pretty rough, and then it would start to recover after that. And then there would be a sort of a week where she'd want to go and at least go and do some work. So I would take her across, and she would just sort of do light stuff and have meetings, and then we'd go back through the process again. I think the support, probably once you get to the end of chemo, it almost feels like, okay, that's it, tick. But it isn't. That's almost the bit where more support needs to kick in.
That's right.
Because I think for Tracy, and probably for others who's been through it, their body doesn't feel the same. Well, it isn't the same. It's been, the surgery, it can be pretty brutal. What the drugs do can be pretty brutal, albeit necessary. But it's quite a significant amount of poison that actually put into the body to sort of eradicate the cancer. So it's then so you're left at this point where the body's different, and my looks are different. I'm putting on weight because of the pills that I'm having to take, and that point, I think, then has been more challenging probably from the chemo, because the chemo you can almost say, right, that's week 1, tick, done. Week 2, tick, done. You just don't know how long things are going to take to recover, and the mind will always remember. Of course. So the mind is sort of remembering, how you were before, how you were during, and then looking at the mirror, sort of when Tracy's hair comes back, it started coming back curly, and she said, "I've never been curly, and I'm grey." And yes, I did say there was one day when she has mentioned it about the Peter Capaldi look, but she did look. The hair was just sort of all over, and it just looked like the photo in the Radio Times of Peter Capaldi. I'm sorry, dear.
So, you know what Joe's Hope is about. How do you think having that support once the chemo ends would help people?
I think it's being able to support, firstly, to basically sort of let people know you're not alone. There are things you can do. There are people you can talk to get, to understand, the symptoms or the things that will have changed. There are, getting access to sort of blogs and networks, getting access to people who can provide, makeup days, mini spa days, or something just to make people feel better about themselves, because you've taken such a hit in terms of all the medical, in terms of the surgery and the treatment, and it's allowing the patient to be them again. And it may not, and by the looks, it may not be necessarily the same looking person. And I think in Tracy's case, I think the Odyssey week was very good for us. So the week that you all went on, to be able to sort of share experiences with people who've been through it, and I think that helped her, because that was almost like a year after that she'd finished the chemo. And even after a year, she was still struggling with her looks, with the wardrobe, because the clothes were all
it's the psychological effects of the cancer seem to have more of an effect than the cancer itself, because you can have the surgery, you can have the medication, you can have the treatment. It's how do you deal with the mental effects of looking in the mirror and not being able to see yourself.
And it's not sort of just taking your mind totally off it, because it will always be there, but at least being able to give people another view on life, or another experience, or being able to make them feel good with themselves, and to feel encouraged to be able to go out and enjoy life again. And I think that's a challenge, because certainly during during the treatment, I mean, Trace would wear sort of beanies, and we would be in sort of supermarkets, and I remember one in our local supermarket, and she almost had a 20-minute chat with another lady who was going through the same process, and they were sort of saying, where are you in the treatment? But she'd also have experiences where she would go and people would just sort of look at her as if to say, oh, what's wrong with you? And I think she found that sort of difficult. That sort of almost makes you feel like I'm not a normal person because people are just looking at me.
So how did you feel when you saw people doing that to Tracy?
Internally quite annoyed and quite protective, but I mean, I don't think I ever actually sort of said to anybody, well, what do you expect if somebody's going through cancer? But that's the sort of the feeling you get. But we just carried on.
So at any point did you feel maybe as though you were very low, or did you always remain stone-faced? It's the best word I'm looking for right now, in respect of the way Tracy was feeling, the way people were treating Tracy.
I suppose we're both the same, and we're both sort of right. Let's get on, do that. I mean, I'd said at the start, I know it's your treatment, and I know it's your body, but I will support as I can. If you want to be emotional, be emotional. If you want to be angry, be angry. I will understand, and I will take my lead from you. And I tried not to be angry, and it almost sort of said, if I was sort of feeling unwell, it's like, well, compared to what you're going through, it's nothing. So, although she does tease me about it sometimes, I can be a drama queen, but it was never. It never got to the point of sort of me getting emotional either. I think because I could sort of see how Trace was fighting it, so it was more a case of, okay, what do you need as support?
So you never took anything she said to you on the bad days personally. You always just said, okay, that's because you're not feeling well, and
yes. I mean, I think that we never had an argument during it. She would, and I would do the photo of her every time she went to chemo, because what she did try and do was sort of she has embraced social media, so she's sort of regularly updating on Facebook. So she was always sort of putting stuff on Facebook about going to the next chemo, and I would always take the photo, so that at least her friends could sort of get an understanding of sort of how the changes were going through, in terms of say the hair or other things, so that people wouldn't be shocked. But I was always there to give her a hug if she needed a hug.
So, in terms of your needs and wants and everything else, and being able to cope with working and supporting Tracy, how do you think you did?
I think I did okay. I don't think I appreciated how tired Tracy was going to get, but how tired I was going to get after a year. I mean, by the time we got, say, to the following Christmas, so by that stage she'd had the reconstruction operation, chemo had been done, she'd also had the mammogram, the sort of the first mammogram after all the surgery, and that had sort of come back clear. And we sort of got to Christmas, and I was like, totally knackered, and that was probably for me that was probably the biggest hurdle, was sort of the amount of tiredness that I went through. But as I say, that's nothing compared to the sort of the stuff that Tracy went through. But I think if I would say to anybody who is sort of caring and supporting, don't expect to not.
I've got one more question for you, Paul. Like, if you could give another partner, whether that be male or female, or anybody who's supporting someone going through cancer, maybe 3 hints or tips of how to support their other half or person that they're actually supporting, what would they be?
I think be engaged in the treatment, be engaged in the whole process. So sitting with, when if it's the wife or the husband is going in for their diagnosis and their be in there, because at least then you can understand what's going to happen, what the treatments are going to be. You will be able to ask questions of the oncologist as to what the treatment is about, because otherwise, I think if Tracy had gone in her own and then I sort of come up and say, right, okay, so what happened? What have you got to, that's then
Very
putting another
repetitive,
strain on her. Whereas just go, listen, try and understand, look on, there are useful blog sites and networks on social media sort of explaining, and everybody's treatment is different. For some women the cold cap works and they don't lose their hair. For others, it's migraines. So understand that it's not just one size fits all. But there are differences. So be engaged. Always prepared to give space. Have your own space as well. So if it is sort of full on caring, make sure that you've got some me time. And find, once you get through the chemo and you're getting to the end, find things to do, whether they're little things, but just sort of things to help the patient sort of become normal again. Which sounds horrible, but that's sort of the way it is, because I don't think at the end of sort of the chemo, Trace did feel completely normal again. It wasn't, her body had been changed in terms of its looks, and it takes getting used to as to where you've got to.
I've given them a new label called pre-cancer self and post-cancer self. So we're always trying to get back to pre-cancer self.
Yeah. Yes, and I think there are elements that I think Tracy would like to go back to pre-cancer self, and she's doing that. But I think things like the Odyssey week that you all did, that I can't say what you did because Hugo would
sworn to secrecy.
Yeah, but that week was really good for her. And since then she's gone off on a 100-mile-an-hour zip wire across a 1,500-foot quarry in North Wales. Thank you, dear. You carry on. I'll sit and watch.
You sure you didn't want to go with her?
Well, fortunately there was a weight limit. That's my excuse. I just looked in and said, I don't think I'm going to be. Oh, sorry, dear. Too heavy.
So thank you very much for talking to us today, Paul. It's been greatly appreciated. Thank you.
You're welcome, and all the best.